So traditional laparoscopy is like what you hear about with someone who's having their gallbladder removed, or other minimally invasive techniques where we use small incisions in order to remove an organ or do some type of internal work without having to make quite the large incision that we traditionally used to do. The Vinci Robot is a minimally invasive technique that has been around for quite some time but is becoming increasingly popular in children. It is an extender of traditional laparoscopy. It allows us to have more precision with smaller techniques such as around the kidney and deep down in the pelvis that allows for fine-tuned dissection that we're not able to do as completely using traditional laparoscopy. Children additionally are much smaller, and so when we're using the robot, we're able to get into smaller areas with a little more precision than we would be able to otherwise. We are using much smaller incisions. Our incisions generally are slightly smaller than a centimeter or half an inch. And with a couple of small incisions as opposed to a very large working incision on a patient's side or down in their pelvis, we're able to minimize post-operative pain, which also correlates with shorter stays in the hospital after surgery. Most of my children, for most of my surgeries that I do, are able to go home after 1 or 2 nights, as opposed to traditionally where they would be here for several, 3 or 4 nights. Most of my children go home without requiring any opioid narcotics post-operatively. Generally speaking, most of my kids do very well with just Tylenol and ibuprofen after surgery. A lot of our kids are able to return to school usually less than a week after the surgery, pending which type of surgery we're doing, but a lot of times they're back to school very quickly. As a pediatric urologist, I operate internally on kidneys, ureters, and bladder. And so therefore, the vast majority of surgeries I'm doing is something called a pyeloplasty, which is where we find an obstruction from where the kidney and the ureter are coming together. I'm able to do that surgery using the robot. It's very precise, and especially when we're talking our small babies, the ureters are quite small, and so I'm able to visualize and take care of the tissues a little easier than whenever I do it open or laparoscopically. Additionally, there are several reconstructions that we do, including a mitrophanol and a malone that we do robotically as well. This is also minimizing, those traditionally can require 3 to 5 days in the hospital, and we're minimizing the amount of time that our kids are here in the hospital for those types of surgeries.